Okay, good morning, everyone. Can you hear my voice?
Yes, ma'am.
Mm, Today we will be we will try our best to complete all the remaining important question, okay? Because the time is very less. And then after these two class, we will try to complete. Then after that, this from tomorrow, I will try to take the whatever your Shaban ma'am have taken, the remaining portion. Tomorrow, I will try to take from tomorrow. Today we will complete mainly the important questions. Is it okay?
Okay, ma'am.
Yes, ma'am.
Okay,
Okay,
okay.
ma'am.
Okay. Can you see? Can you see the slide?
Yes, ma'am. Yes,
Okay,
ma'am.
okay. Okay, so let us start. Okay, this question are very much important. Okay, so that day I have given you all till 101, so we will be continuing with 102 questions. That is like, what is the question? Let us first of all read: amenorrhea, morning sickness, nausea and vomiting, frequency of micturition, breast discomfort, fatigue, etc. are the see the options. Presumption symptoms of early months of pregnancy, and then presumption symptoms of later month of pregnancy, both or none of the above. So you see this, what are these? Amenorrhea means like the woman will have amenorrhea, she will have morning sickness, that is she will have nausea and vomiting, as well as the frequency of micturations. And then you will again see there will be discomfort in her breast and fatigue, etc. So these are what? These are the presumption symptoms of early month of pregnancy, or else the presumption symptoms of later month of pregnancy, or else nothing is right. Say which one is the answer?
Ma'am, early month of pregnancy.
Early month of pregnancy. Okay. Okay, early month. I already gave you all the notes, isn't it, this month? Yes or no?
Yes,
Yes,
ma'am.
ma'am.
Yeah,
Yes, ma'am.
these are the notes given by me and the questions made by me. Okay, it's very important. So as you understand all this, the meaning, all this, and then after that, let's move on to 103. That is the first line therapy for women. Okay, the first line therapy for women with uncomplicated cystitis include a 5 days course of. So what was that? This was also discussed by me. So what was the first line therapy that is given to the woman, okay? If she have an uncomplicated cystitis, okay? And some kind of drug was given, is not it? And the course of that particular drug was 5 days. So what was the name of the drug? I have given nitrofurantoin. So is it correct, nitrofurantoin, or I have made some mistake? I think it is co-trimoxazole, isn't it? What is the answer? What is the correct answer? Open your notes and see. The first line therapy for women for uncomplicated cystitis include 5 days course of which drugs? What was the name of the drug? All of you.
Nitrofurantoin.
Are you sure? Are you sure? Yes or no? Okay, who can surely tell me that
Yes,
nitrofurantoin
ma'am.
is the answer? Okay, Biajit, are you sure?
Yes, ma'am.
Okay, nitrofurantoin is the answer, okay? You open your notes, you will see all these things. Nitrofurantoin was the name of the drugs, okay, that is given to the woman with uncomplicated cystitis, and this drug was mainly given for 5 days course. Okay, are you clear with 102 and 103 questions?
Yes, ma'am.
Yes, ma'am.
Okay, let's move on. Okay, next is 104. So the bladder stoned, and then kidney stoned, colon cancer, cervical cancer, and problem with the nerve that supply the bladder, etc., are the common cause of which disease? So tell me, this was the causes of which disease? A person will have all this bladder stone, kidney stone, all this problem will cause what type of disease? A person have bladder stone, and then as well as kidney stone, colon cancer, all this problem, if a person suffer from all these problems, so that problem will cause what type of disease? Anyone? Don't focus on my option, because my option sometimes might be wrong. So sometimes I give a tricky one, so you just tell me. So these were the causes of what? Of which disease? See your notes. Any one of you? Say fast. The more you will respond late, the more we will be slow. And at the end, just before final, I won't be able to complete these questions. So which one is
Obstructive
the
uropathy.
pardon?
Option B is correct.
Sure.
Yes, ma'am.
All of you? All of you?
Yes,
Yes,
ma'am.
ma'am.
Okay,
Yes,
okay.
ma'am.
Okay, then let's move on. So next, 105. Nephrostomy. All this seen I see: nephrostomy, lithotripsy, urinary catheterization, ultrasound. Any kind of infection is controlled through antibiotic, etc. Following are the management of which disease? So these are the management, okay? Nephrostomy is the management. Lithotripsy is also the management. Urinary catheterization is also the management. Ultrasound also management, okay? And then antibiotic. If there is any kind of infection, you will give antibiotic. So all these following, which I have read out, everything management, which I have read out, everything is the management of which disease? See your notes. Check UTI, check obstructive uropathy. See both are the answer, or what, or else none of the above. Despite of giving you all already the ready-made answer in the screen, you just check it, because what is shown in the screen might also be wrong. So you just check it. So are all these the management of obstructive uropathy or UTI or both?
Yes, ma'am. Obstructive
Which?
uropathy.
Okay. So obstructive uropathy, okay. All these are the management of obstructive uropathy. That is why option B is correct. So are you clear? If 104 and 105 question will come in final, will you be able to answer?
Yes,
Yes, ma'am.
Yes, ma'am.
Okay, let's move on. Okay, next 105. Okay, 106. So see this 106 question very carefully, okay? So very carefully you read this. A patient has complaint of severe right-sided flank pain. So you know now flank pain. What is flank pain? I keep on repeating. What is flank pain? Flank pain. What is flank pain? A patient will complain that in my right side there is like severe flank pain. So what is flank pain? Flank pain.
Abdominal pain.
Between your what? Abdomen and your back. It's not it.
Yes.
Yeah, pain will occur over there, okay, in that particular area. So then severe right-sided, there will be a flank pain, Means a patient will complain that I have in my right side, okay, there arise a severe flank pains as well as nausea, vomiting, as well as restlessness. All these complaint, the patient will give all these complaints. तो मेरा ऐसा ऐसा problem है बोल के complain करेगा. And then after that, he appears slightly pale and is diaphoretic. And then uska skin bhi pura pale hoga, means he will have a pale skin and is diaphoretic. Have you ever heard what is diaphoretic? Diaphoretic? I think you heard this meaning, diaphoretic. Have you heard what is diaphoretic?
No, ma'am.
No, ma'am.
No.
There will be like how to say, diaphoretic means like the patient, you know, he like here, see, he appears slightly pale and is diaphoretic, means his skin will become like his skin will become very pale, okay, as well as like he will have excessive and then excessive sweating, okay, and abnormal kind of sweating, okay, which is like in relation to the environment, and then like all those problem he will have. So that mainly indicate diaphoretic. So you can simply like abnormal sweating that occur, that is, we call it diaphoretic, or else it is diaphoresis. So all these symptoms also it appears in a person, as well as when his vital signs are assessed, we find the complications like his BP is 140 by 90 mm of Hg, his pulse rate is 118 beats per minute, and his respiration is also like 33 breaths per minute, and his temperature is 98 degree Fahrenheit. So which subject data support a diagnosis of renal calculi? So the options are given. The options that are given are the subjective data, okay. These are all the subjective data that will support a diagnosis of renal calculi. It means this subject data, all these will like help in diagnosis of renal calculi. Means despite of like having all these symptoms. So first of all, one by one, you Dibyajit, read the options one by one. Dibyajit, read the option one by one.
Yes, ma'am. Option 1 is pain reading to the
Radiating,
RT
right, okay,
radiating to
right
the,
upper quadrant.
yes, right upper quadrant.
Okay,
Option 2, history of mild flu symptoms last week. And option 3, dark color, coffee ground emesis. And option D, dark scanty urine output.
scanty urine output, okay. So like if a person have all these subjective data, okay, all these subjective data, and then means all these subjective data which is like associated with all this problem, okay, he complained all this problem, he complained all this problem. Despite of that, he also have the subjective data of all this, then you can diagnose that a person have suffer from renal calculi. So these all are the like previous year questions. So in all these vital signs, you need to know the normal value of this pulse, respirations, temperature, all this you know, no need to repeat all these things. So just what you need to know is this: if a person have all these subjective data, okay, then that will help you in the diagnosis of he or she suffering from renal calculi. So this was the all about question number 106. Next, coming to the 107, which finding led to suspect acute glomerulonephritis in a 32 years of patients? So all these were previous year's questions. So it was glomerulonephritis was just the part of some like kidney diseases. It's not, it's just, it was just the part. So mainly the main topic was not there, like that's why we did not like focus on this glomerulonephritis. But in previous years the question used to arise like this. So so even though it is not the exact topic of your this year, but still we will just try to discuss the questions. So which finding led to suspect acute glomerulonephritis in a 32 years of patients? So which finding will see? Option C is the correct answer. Okay, like if a person, like after the investigation, after the diagnostic like investigation, okay, if you find that a person have hypertensions, okay, a person have hypertensions, that is his BP is high, and then if he have oliguria, that means like less output, okay, like less than 400 ml per day, and then as well as if he have a finding of fatigue, like he have a symptoms of all this fatigue, okay, all these 3 points will indicate, okay, that a person is suspected for this acute glomerulonephritis, especially in the 32 years of patients. So here mainly the year is mentioned. So when this question comes, just try to know this was the finding. If I get this finding, there is a chances of a person, or we can suspect a person, okay, that he or she might have acute glomerulonephritis if his age is 32 years of patients. So this was all about 106 and 107. So are you clear? 106 and 107. These are all previous year's questions. Are you clear?
Yes, ma'am.
Yes, ma'am.
Okay, okay. Okay, let's move on. Okay, so when urine cannot flow, either partially or completely, okay, through ureter to bladder or urethra due to some type of obstruction. So instead of flowing from the kidney to the bladder, the urine will flow backward or refluxes into the kidney. It's termed as, so this was taught by whose, ma'am? This was taught by me, or is it a previous year questions?
Ma'am, by you.
Okay, okay. So what will be the answer?
Obstructive uropathy.
Obstructive uropathy. Okay, okay. All of you, why all of you are so silent? When your urine cannot flow, like cannot flow properly, okay, through your ureter, your bladder or urethra, okay, due to some type of obstruction, if there is any kind of obstruction present, okay, then how can your urine flow properly? So that kind of complication you will get. And then like instead of our urine, like instead of flowing from our urine flowing from the kidney and then to the bladder, the urine will flow backward, okay, or else reflux. Reflux means backward into your kidney. It is termed as obstructive uropathy. Okay, next 109. So the surgeon removes the entire kidney, okay, along with the adrenal gland and some tissue around the kidney. So some lymph nodes in the area also may be removed. So what is this? What is this particular, like what is this means, like what this particular term indicate? The meaning of which problem? The surgeon will remove the entire kidney, okay? Read the question carefully. The surgeon, that is the doctor who are surgeon, will remove your entire kidney, not only the entire kidney, along with the adrenal gland and some other tissue which is present around your kidney, and also some lymph nodes in the area, okay, in the that kidney area may also be removed. So this is termed as, this particular meaning is termed as simple nephrectomy, isn't it? Yes or no?
Yes, ma'am.
All of you, is it simple nephrectomy?
No, ma'am.
Then what is the answer?
No, ma'am.
What is the answer?
Radical nephrectomy.
Okay, now explain me. Why did you say radical nephrectomy? It means that you understand what is simple nephrectomy, what is partial nephrectomy, isn't it? You understand all this, like the difference between these 3 terms. That's why you could give the answer. So if the question comes, what is simple nephrectomy? So in the answer, what will be the answer? See your notes. If the question comes, what is simple nephrectomy? So what will be the answer? Hurry up, we have to like be in very speed. All of you here, whoever knows, just say it. I think I did not give the notes, I think. If you all can't answer, that means I did not give the notes. Isn't it? I did not give the notes. It's not it. I never give notes, right? That you could not answer. What is simple nephrectomy? Any one of
The
you?
surgeon will remove only the kidney.
The surgeon? Say
The
loudly.
surgeon will remove only the kidney.
Only the kidney. Okay, then what is, all of you, then what is partial nephrectomy? All of you, whoever knows, say, what is partial nephrectomy? Partial nephrectomy.
Surgery remove only the part of the kidney that of the left.
One of you say clearly. Ilasara, say clearly. What is
The
partial?
surgeon remove only the part of the kidney that contains the tumor. A person with a small kidney tumor may have this type of surgery.
Okay, good. Okay, so if the surgeon remove the entire kidney, okay, along with the adrenal gland, as well as some tissue, as well as some lymph nodes that are present around the area, okay, around the area of the kidney, then it is termed as radical nephrectomy. So that is why option A is the correct. So are you clear with 118, 109?
Yes, ma'am.
Yes,
Okay.
ma'am.
Okay, let's move on. Okay, next. The perception of active fetal movement by the woman, which is usually felt about the 18 week, about 2 weeks earlier in multipara, is termed as there will be like the mother will feel some active fetal movement. It's not the perception of active fetal movement, okay, by the woman, okay, which is usually felt about the 18 weeks. So 18 weeks means what? 18 weeks क्या था? कौन सी trimester होगा 18 weeks? Srijana, 18 weeks will be which trimester?
And second.
Yes, second trimester. Very good. So when the woman is in her 18 weeks of pregnancy, okay, it means not exactly 18, means like about the 18 weeks, okay, especially for those who are like multipara patients. Means primigravida. I mean, sorry, primigravida means the women who are pregnant for the first time. So they will feel this kind of like fetal movement, means their baby is moving inside. So that particular, but those who have those who are multipara mother, okay, like multipara mothers means like those who are not pregnant for the first time, maybe their second baby or third baby or fourth baby. So those women, they used to feel like about 2 weeks earlier than this 18 weeks. That means might be at 16 weeks they already used to feel this fetal movement. So this particular sentence indicate, or this particular meaning indicate which term among the following?
Ma'am, A and B both.
A and B both. Oh, A and B both. Okay, what about others? What about other?
Both A and B, ma'am.
Both, ma'am.
Both A
Both.
and B.
Number one is quickening. Number B is what? What is option B?
Feeling of life.
Okay. And number C?
Both A and B.
Okay. So quickening and feeling of life. So like I just gave you all the both meaning, okay, so that like you just have like confusion, but you all are so much clear with the explanation, so you can just say the answer. So the quickening itself is the fetal movement, okay, the quickening means fetal movement, and the other is the feeling of life. So both the meaning are same, so this indicate the answer of 110. So all of you, are you clear?
Yes, ma'am.
Okay,
Yes,
let's
ma'am.
move on to 111. So the question of 111 is a slow growing fatty lump that most often situated between your skin and the underlying muscle layer is. Srijana, please take attendance, okay? It's just 10 minutes left. A slow growing means it grow very slowly. A slow growing fatty lump, okay? Lump means tumor ka jaisa. Fatty lump that most often situated between your skin and the underlying muscle layer is. कौन सा वाला है option? Tell me fast. Tell me fast which one is the answer. I have written lipoma, but I feel like it's fibroma or fibroma. So is lipoma, the answer is lipoma, or else it is fibroma or fibroma. Which one is the
The
answer?
answer
Lipoma.
Lipoma.
ma'am.
Then what is fibroma? What is the answer of fibroma? Read out, one of you, clearly. Hurry up, don't waste time. Okay, Ilasara, again you read out, your voice is clear.
They are small in size, average 0.5 centimeter or less. They are asymptomatic, more commonly found in women than men, usually occur in the rim of the kidney, may reach the layer size before being detected.
Okay. Okay, Lasara, thank you. Okay, so you all know the difference between all this. Now, in order to choose the option now, that option A, B, C, you need to know the meaning of these three. If you won't know the meaning of this fibroma, if you won't know the meaning of lipoma, oncocytomia, all this meaning, if you don't know, you won't be able to like choose or understand the meaning of this. So now as you understand that the meaning of this is lipoma, so you could choose the answer. So don't get it confused in final exam. So if all this question come in final exam, will you be able to like answer it without any confusion?
Yes, ma'am.
All of you? All
Yes,
of you?
ma'am. Yes, ma'am.
Okay.
Yes, ma'am.
Okay. Srijana, are you done with attendance?
Yes, ma'am.
Okay, as today, like we will be taking 2 classes now. So for now, we will end this. Then after some minutes, like I will send you all the link again. Huh? Okay, then you just join it. Is it okay?
Okay, ma'am.
Okay.
Okay, ma'am.
Okay, by any means, we will try to complete these questions so that tomorrow we can discuss all the remaining topic. Okay, then that's all for now. Okay, thank you, everyone.
Thank you, ma'am.
Ma'am.